guide the biopsy, keep the needle in the needle area center, will keep the implant method to biopsy. We take 12 course systematic with targeted biopsy schemas. The schematic drawings show the principle of the biopsy. 12 samples will be taken during the procedure to ensure the multiple area of the polymer zone. If the polymer zone nodules were found on DRE or species on transect obstruct or MRI, 2 courses will target course will be taken. All process including preparation and the patient's listen position and perhaps locations evaluation before the biopsy and the located disinfection and sterile shoot and location anesthesia, systematic biopsy and conscious adjust for all procedures. All patients were evaluated by transect before procedures. The actuality of polymer and translation were decreased and heterogeneous and increased the vascular in this patient. This patient is 72 years old, PSA evaluated. Increased the vascularly in polymer zone in this patient. And such review, the heterogeneous in polymer zone and transcendental zone increase the vascularity. We mixed 2 intercurrent injections with the 1 normal series injection together, and then 10 millimolars will be injected to the perineal area so that the prostate apex in each side for this prostate apex. This video shows a systematic transperineal prostate biopsy. Capsule biopsy is the polymer zone. The specimen is perfect. It's very important to draw an adequate amount of water for 24 to 48 hours after the biopsy. This will reduce the risk of infection and help clean the urine or blood. Specimen, 12 specimen. Follow-up sample and labeling for samples should be scented in 10% formalin filled bottles, and polymer each individual sample should be scented in different bottles. Causes are all asthma, adenocarcinoma, or prostate. Gleason score 5/5. advantages of transperitoneal prostate biopsy reduce the risk of infection by avoiding the rectum, and ease of detection anterior tumors with transperitoneal approach. Cost-effective, quick, avoids antibiotics, high cancer detection rate. Anterior tumors in this biopsy. New ultrasound images models, such as the contrast-enhanced ultrasound, elastography, were employed targeted biopsy. The contrast-enhanced ultrasound of these cases show the quick wash in and wash out patterns on previous radios and prone to be quick wash in and wash out, and prone to the adenocarcinoma of the prostate cancer and Glasgow 4+4. Quick wash in and quick wash out in right pleural zone nodule. MPMRI is more reliable approach to localize clinical significant of prostate cancer. Target by prostate biopsy by using MRI may help to reduce false negative results and improve risk assessment. So the future trend in prostate biopsy will use the MPMRI to guide the transrectal ultrasound biopsy. MP transrectal ultrasound and be used with the MPMRI to improve targeted biopsy. T2 MRI rigid scan and contrast enhanced ultrasound. And this figure fusion image between the T2 MRI rigid squared and the astonography, and T2 with conventional B model imaging, and T2 MRI with the conventional model images. Summary main lectures. Transrectal ultrasound guided transperitoneal biopsy now exists to be safely and comfortably performed under local anesthesia in office setting. Transperitoneal biopsy clearly has a low rate of infection and ease of detecting anterior prostate tumors with transperitoneal approach. Thank you, and welcome to Bulin Zhang, and thanks.
Thanks for Professor Zhang Bulin. The study suggests that transrectal ultrasound-guided prostate puncture biopsy is a safe and effective diagnostic tool, particularly when performed under local anesthesia, reducing the risk of infection and facilitating the detection of anterior prostate tumors. The future trends in the clinical application of this diagnostic approach may include the combination of this method with other diagnostic modalities such as MPMRI. The second, the future prostate puncture biopsies may benefit from AI. Summary, transrectal ultrasound-guided prostate puncture biopsy is a procedure with high safety and effectiveness, particularly advantages in the detection of anterior prostate tumors. With ongoing technological progress, this diagnostic method is expected to play an even more significant role in clinical practice in the future. Thanks.
Next, I will introduce Professor Li.